Welcome back. Dr. James Park is here with us from Hoag, and we're going to talk about epilepsy and seizures and how they can occur. Well, thank you for being with us.
Thank
nice
you for
to
having
see
me.
you. So you're a neurologist, and I knew I would say this wrong, epileptologist. Did I say it right?
Yeah.
So let's talk a little bit about what that entails, neurology and epilepsy. Tell me about it.
So a neurologist is, someone who studies the nervous system, the brain, spinal cord, peripheral nerves, and things like that. And an epileptologist is someone who does extra training in order to diagnose and treat epilepsy, kind of a full gamut of treatment for that as well, which we can talk about a little bit more as well. But it's just a neurologist who's had additional special training for that specific disease.
Okay, and how long have you been involved with epilepsy?
So I've been here at Hoag for the past about year now, and then I was back in the East Coast in Philadelphia doing my fellowship at Jefferson Hospital, which is one of the top epilepsy centers in the country.
Okay.
I was there for 2 years before moving out here. So.
Okay, yeah. All right, great. So seizures, they can be caused by, excuse me, all sorts of different things. So let's kind of have an overview of what causes seizures.
So seizure essentially is just a abnormal electrical discharge that occurs in the brain. And that really can cause any sort of symptoms because the brain controls everything, and depending on where the seizures start and spread, you can have various symptoms with that. But the most kind of commonly thought of in terms of seizures, the big kind of stiffening and shaking and losing consciousness, but really it can be a variety of symptoms. And the causes can also be a lot of different things. In kind of younger patients, children and infants and things like that, a lot of times it's more genetic causes. But as we get older, kind of into adulthood and later in life, it can be other things that are acquired, things like head trauma, brain tumors, strokes, or even sometimes just unknown causes, maybe something that was lying dormant and just became more active when it was when the patients became older. So it can really kind of range a huge range of causes for, and so that's where again a specialist sometimes can be more helpful in that in those cases.
Now, before we came on, we were talking about an example of somebody who had a seizure from medication that they were allergic to. So, but you're saying that it's possible that may have been caused by something else that's not known. So, when someone comes to you with that concern, you would be able to tell the difference between it being a one-time or something that's constant.
Yeah, and that's what we try to determine by a good history. That's actually one of the most important things, is that a lot of times patients will come in and it'll be their first time kind of bigger seizure. But when you really delve into it, it seems like, oh, they actually were having these unusual symptoms for the past few years that sound like maybe smaller seizures, and so then really they would need treatment. Or you discuss with them kind of other provoking causes or other things that could potentially cause seizures, but they may not necessarily have an underlying risk for recurrent seizures. And so a good history and determining those things do help us to figure out whether someone has that recurrent risk. And then from there, other tests that we can do, such as imaging and the brainwave test, the EEG, to determine kind of help determine if the patient does have an increased risk for seizures. And so that's kind of an overview of kind of what we do in terms of making the diagnosis.
So from an age perspective, I know you mentioned that children with possible have some head injuries or things like that, but also there's genetic situations too. So is there a particular age that you need to look for these things?
It can really be any age. There are many adults that we see too who just have a strong family history of epilepsy, let's say, and so sometimes we'll do genetic testing on those patients as well, just to see if there is some gene that is coming out that would predispose them to it. There are epilepsy syndromes and kind of more well-known genetic causes too that we see in children, but there are many other genes that we still are kind of learning about and that we're exploring in terms of even into adulthood and things that may play a role.
Okay.
in causing epilepsy. You know, why do certain people who have head injuries or have strokes and things like that develop epilepsy, and why do others that have the same thing not develop epilepsy? So there's some genetic component to it as well.
Okay. Yeah. And then you mentioned that medication can help a lot of people. So what kind of medications are these? Just pill type forms, or do you have shots, or what kind of medication?
Most of the seizure medications are pill form. They do make, you know, liquid form and IV forms for ease of use in different situations, but most of them are pills. And now there are about, you know, 20 plus medications out there for treating seizures. There was an explosion of them back in the kind of 1990s, and so we have more available to us to really treat patients and hopefully find something that works to control seizures, but also minimize side effects. That's really the goal. Again, I think there are newer and better medications coming out in terms of side effect profiles as well, and so that's kind of an important part of treatment.
Right.
But there are many patients where medications also don't work. So about half of patients will have good outcomes with the first medication that they try, that it controls their seizures, and that's what they stay on, as long as they don't have side effects. And then patients who try the second or third or fourth or even a combo of medications, you only capture about maybe another 10% or 15% of people. So about 2/3 of people are well controlled with medications, but then you have a third of patients who actually medications don't work to control seizures. So they may have a little honeymoon period where for about, say, a month or so have good control, but then after that, seizures come back. Or some people where you try multiple different medications and still seizures are not controlled.
Right.
And really the data out there shows that when you failed 2 or more medications, the likelihood of another medication working is actually pretty low. It gets to be under about 5%. And so that's really when we start considering is surgery an option. So there are many surgical kind of procedures now that are available for the treatment of epilepsy. In the past, it used to be just, can we cut that abnormal part of the brain out? But now, that's still the mainstay of epilepsy treatment with surgery, because that's the one potential curative option.
Right.
But many patients who are not surgical candidates in the past, for instance, if they had seizures on both sides of the brain or multiple places in the brain that you just can't cut out all those portions.
Right.
Now there are a lot of new treatments like devices available. There's a vagus nerve stimulator, responsive nerve stimulator, which is kind of like a pacemaker for the brain.
Oh, wow.
Deep brain stimulator, which was used in Parkinson's and tremor for a while, but now it's approved for epilepsy.
Great.
So all these devices also kind of are another option for patients who where resection was not possible. These are options that we can use to try and control seizures better where medication really hasn't worked.
Well, it seems like Hoag is really doing a good job of kind of looking at every angle. And there's an NAEC accreditation. Tell me about what that means.
So it's just a National Association of Epilepsy Centers, and they have a level tier in terms of designating what kind of services are available for epilepsy patients and things. Most academic centers are level 4 centers, and Hoag is actually one of the few kind of private hospitals that does have a level 4 center now. So we just received that accreditation a few months ago, and so we're very proud of that. And it just means that we can provide comprehensive care for our epilepsy patients. So not only treatment with medications and diagnosis and things like that, but ultimately for the refractory patients, being able to provide surgical treatment for the epilepsy. And I think here in Orange County, that's sorely needed, and or just Southern California in general is sorely needed. I think for the population we have here, we actually have only 2 level 4 centers here in Orange County.
Oh, wow.
So it was a huge need, and I think Hoag recognized that, and we're kind of filling that gap. And so, we're excited to kind of see where it goes, and again, to be able to provide that excellent care for our patients.
Perfect. Well, thank you, and congratulations. That's really a great thing for you guys. Thank you. And remember, if you would like to know more information about what we just spoke here, you can go to hoag.org/epilepsy. We'll be right back.